Okay, so my name is Isabelle Soerjomataram, as everybody just heard. And then birthday is really one of my favorite event. So I'm really happy to be here in the Netherlands. I'm really happy then to be invited to this really special event. And then for those who sometimes or most of the times get my back, I'm really sorry. Okay. But then, so I did my PhD in the Netherlands, so I knew then a little bit of how the data is used and then how impressive the data has always been in the Netherlands. But it is really, it's really even more amazing today. But then what I'll do today is then I'll give you a little bit of the history of cancer registries in general. I'm not going to get into the Dutch cancer registries. And then I'll give you a bit of example of international examples of how the data is being used. And then at the end, usually then I'll give a little bit example of how the Dutch data is being used. So I was happy that someone, Vincent, started with the whole verhaal history. So I'm going to go through the history, and then I was trying to find a picture where then the woman telling the history was a little bit younger, but actually it was rather difficult. So that's the picture that I found. And then I was also told that if you want to tell a good history, you should use metaphors. Okay, metaphors. One of the metaphors that often used, you saw it already in a body of someone, which is a tree, so the cancer registry. But then there's a lot of other different metaphors. So this is then the tree that you saw just now. So I'm not going to go through any of the other metaphors because in my culture it's actually quite difficult to tell metaphors in histories. But what I'm going to do is, those of you who knows about the history of cancer registry, please stand up. Jan Willem? Valerie? Okay, so if you want to know a little bit more about the cancer registries during the break, please come to these people, okay? And then if you want to know more about other metaphors of cancer registries, does anyone here know more than 4 metaphors? Please stand up. Okay. Then please come to this gentleman, and then he will be happy to explain to you the other metaphors. Okay? So what I want to also then show later on is that this tree didn't start like a big tree like you saw at the end there. The tree starts really with a little seed that grows and at the end become a really nice big tree. And that's also a little bit how the history of cancer registry started. So it started way before the 1900s, but then it started really with the population surveys. So people asking how many people are having cancer. And one of the oldest one that I can find some kind of a nice pictures and books and description is what it's called the bills of mortality. So this is not registering cancer cases like what we know of the cancer registries today. It registers mainly cancer death. So it started in England, in the UK, where then there's a famous person that for those learning, studying this would know the name, put together all the number of deaths and then the causes of death at that time. And then he came up with reports such as this one. And then, for example, this is the 1600s, and then you see then much more deaths that are then related to infections. So there's plague, fever, typhoid, etc., etc. But actually, he also mentioned cancer. So there were only 2 cancer deaths at that time. Huh? And then if you see then the data again 300 or 400 years afterwards, typhoid cancer before, that was really a lot. It became much less. And then in the 1930s, you see then cancer starting to come up. And then a lot of it that changes is what then pushes more and more the development of cancer registries. So that was really then the beginning of it, and there's other examples of how that surveys was done, but then really the beginning of cancer registry started probably in Germany, in Hamburg, when then people, especially then clinicians, started to say, we need data about patients. Okay, we don't want death, but we really want to see data on patients. What that time they did is, they sent letters to the doctors and then asked the doctors, fill in these formulas, return the formulas to me, so then I can then count how many cancer patients they were. And then the idea was thought that a lot of people thought that the idea was really wonderful. The Dutch immediately followed that example. Spain also did it in a small city, Portugal, Ireland, and Denmark. But then, at that time, what happened is only 30% out of all of the cancer cases were actually coming back. So a lot of the clinicians weren't returning those letters. There's a guy here who's called Bashford, who then said, this is a really worthless effort. Stop it. It's not really useful because you're missing a lot of your cases. The Hamburg people continued to start working on it, and then they're thinking how to do it. So then in 1926, so this is a picture of Hamburg. This is the only thing that I could find from that period when there was a traffic jam, which happens very rarely then. And then what they did, they sent registrars, so nurses, to each of the hospital and then asked the registrar to then record the cases. And using that example, actually, the completeness of the cancer registry started to become better. And then if you see cancer registries today, it's almost the same infrastructure that is then used then. Some other countries said, no, we're not going to waste the time on paying the nurses or the registrars. So in Connecticut, the Americans, they use it a bit differently. They still then sent letters. But then what they did, I'm going to tell the government to make it obligatory. So all hospitals sent then the data back to the registries. So then you see today, registry are kind of working on one or two of these methods. The Denmark then started then with the national registry since 1942. Probably that is one of the oldest that you see today. After that, a lot of the other Nordic countries started. I think the Netherlands with one of the registries in the south started in 1955, collecting more data. But then what you're seeing also happening, a lot of our low middle income countries started to try the effort as well, collecting data in Nigeria, Chile, Uganda. And then what happened afterwards is really then the start of the big international data collection. It started also the big international association trying to put the same methods and data of collection in different countries, so then you really then can start collecting comparable data and compare data over time or by locations. And then this is then what we see today. If you see cancer registries in Europe, so this is then at the beginning in 1970s. There were then that time Danish cancer registry that was then already national. There was then the little spot in Germany, which is then the small blue in the north, and there was then Slovenia. And then if you see it over time, it is really growing. It is really growing, and then today almost most of European countries, we have cancer registries activities going on. And then we're using this data, this really gold mine, a lot. What happened then as well, we started to be able to compare data over time. So this is then an example of a collection of the data, cancer registry data, which is called Cancer Incidence in 5 Continents. So CI5 stands for Cancer Incidence in 5 Continent 1, which is then collecting data around the 60s. And then Cancer Incidence 11 is then the newest what we have then today. This is then in Norway, one of the oldest at that time. And then you see then the data on the left, where then stomach cancer was really important. It went really out. It's the green line, means it's no longer in the top 10. And then you see some other cancer going up with time. You see prostate cancer becoming more important, colorectum, and then I really want to point out to the colorectum and melanoma, which I'll use then in later examples. You see then this data for females, very similar. Breast cancer has always been important, as you see. It remains #1 cancer in Norway. But then what you see as well, the rate, so the number of cases, for example, here then in Norway, grows a lot over time. So this is just a very, very simple use of the data, but you can already see a lot of different things. There is cancer that are disappearing, cancer that are going up, and then you can also compare, look, this cancer becomes much of a bigger problem today. And then this is then the data from the Netherlands. It's not completely the same Dutch data. So previously, around the 60s, there was data which is called the 3 provinces of the Netherlands. And then in the newest data sets, you see really then the data that we have today from NKR. And then you see then prostate cancer becoming more important. Lung cancer is going down, so we're doing really well here in the Netherlands, but colorectal and melanoma is then going up. And this is then for female. Breast cancer remains still very important. The rate is becoming really, really high. Colorectal and melanoma is also very important in women. So that's then a really short, brief history of the registry. So I'm going to go through now to 2 examples of how this data has been used. I'm going to go through just really 2 basic examples of public health use, and then you can use it into much more examples, actually, where then you're using cancer registry data to hypothesize of what are the causes of cancer. You can then see it also impact of public policies, prevention, especially if you're looking into then incidents or new cases, and then screening, where then you're having then a next presentation on it. And then this is, I kind of then think of it of a smaller tree, which then you see on the right, because probably this is one of the basic things that you can do already with the data that you have if you have high quality cancer registry data. Okay, so I'll start then with skin cancer. So I was looking then into the past, into history of skin cancer. So there was then a study in 1945 studying then skin cancer. This was done in Mumbai. They had then 3,000 cancers in the cancer registry then, which is then much more cancer registry in a hospital. They found only 8 in men and 1 in women. And if you see the abstract, they said, this is probably related to their clothing. And then I'm thinking, oh, wow, at that time already they're using different clothing that may be more linked to the sun and some clothing that are not linked to the sun. But it's actually not that. So when you see again then the whole article, they're talking of clothing in a very different way. So this is then, they were talking a lot about sari, which is then the female dress, traditional dress, and dhoti, which is then the male dress for Indians at that time. And what they kind of then said here, so it's not because of whether then exposure to the sun, but it's because of the frictions that clothes have on certain parts of your body. So I didn't put that on the rest of the part, because then you can imagine with men, they found more, especially in in some part of your intimate parts, because there's a lot of pressures then that is then related to the clothes. And while female dresses, it's just so loose that you don't have that pressures, and that's why you don't have skin cancer. But then it moved then further on. When we had then started to have data from international data, this is then what you saw. This is then again CI5 data at the beginning. You don't yet see much of a difference. The skin cancer at that time was much lower than what you see today. There are differences then if you see among the whites and then among more colored populations, but it's not yet that big. But then at that time already, they added then in data for here then you see in the United States, the white population has then much more skin cancer than the black population. Then they started still discussing about the clothes that the whites and the black were using, but then they started then to think a bit, or maybe it's also the skin color, but not yet into anything related to actually sun exposure. Until then, more recently, when then they started to see, okay, the whites that are living then in where there's much more sun exposure, they're having much more skin melanoma, and probably that is then the causes of skin cancer. And then today, now we really know well, okay, sun exposure is one of the important causes of skin cancer. So then if you see then what's happening with skin cancer, this is then what we see in the Netherlands. It's really then an important cancer, but then you see it actually everywhere else in the world. I'm putting then on the left-hand side where then the population have a more fair skin. And then you see as well then there in Australia and New Zealand where they're having a really strong prevention program that then skin cancer started to really then slow down. If you put this then by age group, in the younger age group, skin cancer is going down really rapidly. They're having really then the first proof, okay, prevention does work to reduce then the cancer rate. And then you see then a bit then among the US black, rates remain the same. You see rates are also then much lower, and a lot of the other population, nothing what then you see in the fairer skin population. This is an example in the Netherlands. You see on the lower bottom, the bars are number of cases. It's increasing really a lot. And then on the top, the line is then the rates. What we're seeing in the future, the rate is still going to go up, but it's starting to slow down as well. So the younger people are starting probably to take care of things better. But if you see the number of cases, we're going to still have a lot of melanoma cases in the future here. And then that's really was the part of the work of Lonneke. Many of you probably know this work, but also then the most recent publication that I just saw published online, saying that really we need a special plan for skin cancer in the Netherlands. So what we are collecting is not only then collecting data on evidence of causes, but you see that it also taken into actions, hopefully then finally to really reduce the burden of skin cancer or other cancer in different countries. Next one, and this is my last example on cancer survivors. So taking this a bit further than looking into patients care, we can look into prognosis, but other part as well that I know is being done here in the Netherlands, just to show that the trees are growing bigger. This is then the exact tree that you have in the body of Jan Willem. And then it started off, one of the examples that I take is then again from another international comparison, which is called Eurocare. So in around the 1980s, people are starting then to think about survival, and then they're saying, okay, we need to compare countries. And then they saw here UK and Denmark having a really, really low survival. They did it again. UK and Denmark have a really low survival, much more the same like Eastern European country. The government felt really, really bad. What happened is it came out of the newspaper everywhere, and then there's a lot of people, of course, asking the data is not good enough, so don't trust it. But then the other thing what happened is government started to put a lot of money into patient care. So something did happen. And then we did then a newer study now today to look into then the changes over time. So UK, even after the amount of money that they spent, they're still in the bottom. But what you see that the survival is still improving as well. And if you see Denmark, they were before the same like UK, and today they're doing really, really good. What they did, they really then changed the whole referral pattern. So you see that international comparison can really push countries to do better in different terms. This is then an example in the Netherlands about centralization of esophageal cancer. I'm not going to go through there, but then in the Netherlands, such example is also used. And then you see then this is survival for esophageal cancer in the Netherlands that's going up because of the changes in treatment, but also then how the quality of care and where then patients are being treated become better. It's not always easy to do cancer registration. There's a lot of challenges. I'm listing really only a few, not to be negative on this very good day of the birthday, so I'm not going to do it through it all, but it's really, really worth it to do it properly. So, finally, thank you so much then for inviting me and then for listening to this small story, histories. Thank you for all the cancer registries who's sending it, organizers who's inviting me, and Willem Koeberg, then who's giving me a lot of the inspiration. But I'm hoping that the trees in the Netherlands, but in other parts of the world, will grow and will grow strong and then create the forest of cancer registries in the future. Thank you so much.